Often we will get patients that come into the practice and they say, well, my implants last forever. So that's a very tough question to answer. The way I try to phrase it is this: the teeth that we have didn't last forever, and we're replacing them with implants. And we know that implants have been around for 30 to 40 years as far as studies go. But nothing lasts forever, but we can prevent certain measures that cause implants to not last as long. Some things that do affect how implants heal are things like, if a patient is a smoker, we tell them that there's a chance that the implant may not last as long. We can also tell patients that they need to come into the practice every 3 to 4 months for regular maintenance and cleaning around their implants to help prolong the treatment life of their implants. Especially for dental implants, home care and regular office care is very important. So when you come in, we're also going to be looking for a few things to make sure that your implant stays healthy. We are going to check for redness around your implants to make sure that there's no inflammation, there's no bleeding, there's no deep pockets. We take regular x-rays to also check the health around your implants. We want to make sure that there's no pain, there's no swelling that you've had at home reoccurring. These are all signs that something could be wrong. And we also want to catch these things very early, especially with implants, so that we can treat them appropriately. At times, it's not actually the implant that has the concern, but it's the crown or the connective part on top. Sometimes the screw could be loose in the implant and it just needs to be tightened. Sometimes there are small things that we need to check, like the bite with the implant. It's important for patients to let us know if they feel anything seems off or wrong with their implant treatment. It requires regular maintenance and home care, but also checking by us to make sure that you get the most expected lifespan of that implant treatment.